Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you, and today we will discuss a very new public health threat in Pakistan and India, which is Nipah virus threat and outbreak. Two cases have been reported in India recently, and there is a border health security concerns as well as the Indian authorities, and Pakistan has also issued alert on all the entry points, including seaports, airports. And today I was seeing the news in one of the very popular English daily from Pakistan Dawn, and there is a screening at the Jinnah International Airport, Karachi, and doctors, quarantine officers, they are also with their tests as well as their screening skills. They are available, and nobody is allowed to come out without screening in the airports in Pakistan. National Institute of Health has also issued the advisory, and nobody will be allowed without screening, and even the history of 21 days, because the incubation period of this deadly virus, which is basically, as you can see in my background, it is a palm tree, but date tree, which is very close to it, gives dates, and this fruit season is going on in Pakistan and India and even in Saudi Arabia. The Muslims feel that the dates are one of the fruit which is having divine properties, and they have a religious history and background. So most of the people, they have their uh, crops, as well as in Sindh, the Khairpur district is called the date estates, and there are zones, commercial zones, and same is true that it is international trade. So Nipah was basically a Malaysian river, and there was a garden in which this fruit picking people suffered from symptoms of fever, headache, respiratory distress, and ultimately they became mentally oriented. So this kind of symptoms were diagnosed in 1998 and 99, and because of that linkage, the virus was named as the Nipah virus due to that kind of geographical location. So its origin is in Malaysia, and it is basically moving in different stages or in a different years from 1998 in South Asia, including Pakistan, and few cases 2 years back were reported from Khairpur, and the government has issued the alert. So with a few slides, I will show you that how much threat is to Pakistan. And the Nipah virus is a RNA virus, and there is no vaccine, but there is a quick diagnostic blood test. But symptomatic tests are done person traveling from these countries and having fever, cough, as well as the respiratory symptoms. They are quarantined or isolated. The quarantine is a public health term in which a maximum incubation period a person is isolated. And I have seen in Karachi, Airport Health Authority has a hospital as well as isolation ward and quarantine wards. So it is regularly done, but mostly for the yellow fever. But now these viruses are coming up with new names, with new dimensions. So it is 70 to 80% fatal disease. So it is very close to rabies virus. Hence, the Pakistani people and the general population, as well as the universities, medical colleges, should send their alerts as NIH and the Ministry of Health has already issued the advisory. So let us see a few slides, and I think that will clarify most of the points which I am trying to give you in my intro or in my introduction. So if this comes, sharing comes, okay, it is fine. So this is first slide. You can see that on the left side, the doctors and quarantine officer in Karachi are there, and in the between is the diagram or microscopic picture of the Nipah virus, and you can see the bats are the vector are the main source. As for the rabies, dogs are the main source. Here, the bats are the main source of the Nipah infection, which is fatal as close as to the uh, rabies, and it is so dangerous, and it can create a lot of problem in Pakistan also, particularly Sindh, the Khairpur district and districts where dates, trees and crops and gardens are there. They should take care of this. This is basically the spat of the dates, which is very big, and is just like a small aeroplane. So when they fly, it gives a lot of fear to the people, and those who are the date pickers are dealing with this. They are contaminated, their hands are contaminated. So this virus can be on the dates as well as the food which they consume or they keep and handle. These all things are related to the. So there is a person to person contact, and if you are laborer and doing the dates collection and date trades, then you can have this infection. So even the Singapore, Malaysia, and other countries have issued the alerts to their airport authorities and seaport authority. And you can see the Nipah virus is named after Kampong Sungai Nipah River Village, a village located in state in Malaysia, Sembilon state in Malaysia, and this where the virus was first isolated 99 from a patient during an outbreak of severe encephalitis among pig farmers. So pig are also one of the source of Nipah virus uh, along with this bat. So once again you can see how the this is yesterday Karachi airport, and you can see how the screening is done and how the health authorities are on alert. This is the security force. Nobody is allowed out from the asile or from the that barrier. So you can. This is same situation and this is a Nipah virus test which is done from the blood, and this is where you can see the pigs, the bats, and the palm trees, and the affected person. And you can see that there are symptoms, fever, as well as other symptoms are there. But respiratory and encephalitis are important aspects. From this, you can understand more symptoms and causes, risk areas, mostly outbreak in South and Southeast Asia. Pakistan is in South Asia, so no specific treatment, prevention, avoid bat exposure, ensure food hygiene, isolate the cases. And then Pakistan tightens the border surveillance over Nipah virus threat as India confirmed 2 cases. Singapore, Hong Kong, Thailand, and Malaysia authorities also ramp up airports screening to curb spread of this disease. So let I should end. The presentation is long, but I am showing that how government of Pakistan has issued on the 28th January yesterday this advisory, and this shows a complete guideline to the GPs and border health services. Pakistan is looking to this, and no individual shall be allowed entry Pakistan without health clearance by border health services of Pakistan. This is a specialized force, and you can see that the incubation period is 21 days. So the history of the 21 days from the affected area. So let once again I should show that how this disease from the dates and from the trees, fruits reaches to the human being and creates the Nipah disease. So this is once again how the symptoms and other things maintain hygiene, wear mask and seek medical as early as possible. With this, I think once again I am uh, showing you that the the Nipah threat is real, and all the preventive measures and the mass media in local language in Urdu, Sindhi, or Pashto, Punjabi, they should provide the correct information. There is no need of fear, but there is need of urgent kind of uh, prevention and attention from all the stakeholders, particularly the medical students, MBBS students, postgraduate students, and even the current affairs students should understand that Nipah virus is a new threat and a new public health emergency like situation, not emergency, but emergency like situation. Please like, share, and if you have understood better, please drop comments and push the like button and share it with the colleagues, especially the MBBS students, the postgraduate students, FCPS students, nursing students, and the health authorities will benefit from this presentation. I have taken this material quickly from certain newspapers, and I want to acknowledge uh, this kind of information, which Dawn newspaper and Tribune are, and even the Indian Express. These are the newspapers where from I have taken this information. Dr. Hussain Bashkolaji, once again, thanks you, and we are ending this meeting.